My name is John Allen. I'm a physician with an MBA, fellow of the AGA. I was the president between 2014 and 2015. I've been involved with the AGA in its leadership capacity since 2009, and have a pretty good perspective on that history. Let me tell you how I got into medicine and how I got into gastroenterology. It's kind of an interesting story. I was tagged by my grandmother to be a physician when I was 5, and I actually believed her. And so I really planned my entire academic career to be a physician. Of course, she wanted me to take care of her. That obviously didn't happen, but that got my interest in medicine, and so I veered into the sciences. I have one older brother who went into the hard sciences, became an astrophysicist, and so I became a people scientist and went into medicine. And went to the University of New Mexico, which was about the best return on investment I could imagine in terms of the tuition cost. And then I got into internal medicine at the University of Minnesota, and there I met several gastroenterologists who were really key in piquing my interest. And at about that time, really only 5 or 6 years earlier, had people gone with endoscopes out into private practice. And so the whole era of endoscopy was just exploding. And I happened to be at Minnesota, where some very, very famous endoscopists, Jack Venice and Steve Silvers, were, who brought ERCP to this country, actually. And John Bond, who headed up the National Polyp Study. And so it was a really key group of people that piqued my interest, not only in gastroenterology, but also in clinical research and asking questions at a systems level. After my training, I practiced at the VA hospital, really working closely with Craig McLean, who's now chief at Louisville, and developing nutrition and immunologic approaches to some of the GI diseases. And after about 10 years, I realized that research was not my core strength. It was still an interest, and the whole concept of asking questions was just part of me. But I decided that working in academic medicine and running a research lab was, again, not my core strength. So I looked around and I got an offer to go to a Minneapolis-based, first of all, clinic and cancer center, and then get connected with the practice that eventually became Minnesota Gastroenterology. And I transferred really from academics into community practice at that point, and realized that Minnesota Gastroenterology was one of the largest GI practices at that time, and eventually became the largest. But they had a treasure trove of data in their paper medical records. And just putting some simple questions together, I realized the potential of research in community practice. And that got me again interested in thinking systematically. And with that strong community practice background, I looked at the various societies, and AGA in particular, and thought, there's a real need to bring community practice and the business of GI into the attention of our societies. And it was interesting picking AGA, which is traditionally a very academic society. It was frankly intimidating for me, coming from private practice, to try to break into the leadership. And again, I happened to have Cecil Challey, who was at Minnesota Gastroenterology, sitting on the governing board of the AGA, and he was actually the one that said, John, you ought to get into this and think about it. And that's how I started out, as on the leadership track of the AGA. My very first experience with AGA was with Martin Brotman, who was heading up a quality committee staffed by Wendy Cohen. And I went in and sat in on that and kind of had no clue what was going on. I mean, I was really quite naive around that. But I looked at Martin Brotman, who again was in practice, not at an academic medical center, and saw a potential to bring a different perspective to the AGA. Not the traditional academic research and academic model, but really the business of GI. And at about that time, I was 50 and I went back and got an MBA and really became interested in the business of GI. And so when I got into the leadership of AGA, I was sitting in the room with these phenomenal researchers and brilliant people, and honestly thinking, what could I contribute? It became very clear very quickly that they really did not understand the business model of community practice. And so that's where I got into a clinical quality business mode of AGA and hopefully brought that to the society. When I was president in 2014 and 2015, that was about the year that effective treatment for hepatitis C started. So that exploded. And what was interesting in my professional career, H. pylori was defined, and Barry Marshall won the Nobel Prize for that. We had been calling hepatitis C non-A, non-B, which is this mystery virus. And in just a couple of decades, not only did we discover the virus, but we sequenced it and then developed effective therapies. So now, after a few weeks of oral therapy, we cure what was once the leading cause of liver transplantation. And those are the exciting times. And that was also just after the Affordable Care Act was passed and the beginning of all the quality metrics and incentive bonuses and alternative payment models fit right into my expertise as thinking about the economics of healthcare and the business of healthcare. And so things really meshed together in very, very exciting ways. It's a time, frankly, of a lot of fear of the tremendous changes in healthcare and also the beginning of the polarization of politics in the United States, which directly affected healthcare legislation. So getting involved in that and thinking about that was really some of the key memories that I have. During my time in the AGA, I think my major mark was to bring a consideration and appreciation of the value of community practice, an understanding of the evolving business models of GI, including what is now the predominant business model, which is private equity-backed practice acquisition and expansion, and really continuing to emphasize how looking at quality metrics, looking at registries, that type of approach can really directly affect patient care and enhance the society as well. From a personal standpoint, when I first started in leadership in the AGA, Bob Sandler actually invited me as a guest to the 2009 governing board. And I walked in that room, and again, I was completely intimidated because I was practicing gastroenterology in a small clinic in Bloomington, Minnesota. And, what could I add? And again, just staying in your lane and understanding your own strengths and not trying to be someone you're not, you're able to contribute in ways that you just can't predict. And so that has helped me grow. And before I started in leadership, I was not really a polished speaker, for example, but during my presidency, I had 47 or 50 presentations to academic medical centers, to societies, to, up to and including the presidential plenary, for example. And I became a really pretty good speaker and was able to put together sentences and thoughts in ways that I think helped other people understand things. And so it was life-changing, frankly. I have a lot of hope for AGA's future. I think AGA remains the society that has tremendous integrity, tremendous scientific integrity, and I hope that continues. I think AGA can convene a lot of the new technology, the new thoughts, the new approaches to gastroenterology in ways that are really unique to our society. We're now seeing an explosion of artificial intelligence, machine learning, digital health, different ways of practicing. And I think AGA can bring together providers, payers, patients, whoever is needed, FDA, regulations, CMS. AGA is a tremendous convener of people coming together and seeking solutions. And I hope that continues far into the future. I think if I was to approach a young person who's interested in medicine, I would again emphasize that gastroenterology is one of the most exciting specialties to go into. It has probably the biggest pipeline of pharmacotherapeutics. It also has a pipeline of endoscopic therapies and techniques, and it combines really the best of everything in education, in research, in clinical practice. And the field of gastroenterology, as I mentioned before, just exploded during my professional career, and I don't see that ending. I think the potential is great, and if I was to encourage anyone to go into medicine, I would say gastroenterology is a wonderful place to land.